Ever wondered how prevalent erectile dysfunction really is in our society? Well, you're not alone. It's a question that's often left unasked, unspoken, and untreated due to societal taboos and embarrassment. But today, we're going to bring light to this all-too-common issue, often shrouded in silence. Erectile dysfunction, or ED as it's commonly known, is more than just a bedroom issue. It's a health concern that affects millions of men worldwide. It's a silent struggle. A hidden epidemic that needs to be openly discussed and addressed. It's not a topic to be brushed under the carpet or whispered about in hushed tones anymore. It's time to break down those walls of discomfort, time to shatter the silence and bring this issue out into the open, because only when we acknowledge it can we begin to combat it. So, let's take the first step together today. Let's dive into the facts and figures to understand how widespread this issue really is. It's time to confront the numbers. Erectile dysfunction, or ED, is more common than you might think. It affects millions of men worldwide, and the prevalence is only expected to increase. According to a study published in the American Journal of Medicine, 1 in 4 men under 40 reported experiencing ED at some point. This condition doesn't discriminate based on age. Although it's true that the likelihood of developing ED increases as we age, it's not exclusive to older adults. In fact, an estimated 25% of men who seek treatment for ED are under 40. That's a significant portion. But age isn't the only contributing factor. Lifestyle choices play a significant role too. Unhealthy habits like smoking, excessive alcohol consumption, and lack of physical activity can all contribute to erectile dysfunction. In addition, men who suffer from certain health conditions such as heart disease or diabetes are at a higher risk. It's also important to acknowledge the role of mental health in this conversation. Stress, anxiety, depression, all these can lead to or exacerbate ED. As our understanding of mental health continues to evolve, we are realizing more and more how intertwined our physical and mental well-being truly are. Now let's talk geography. ED isn't confined to any one region. It's a global issue. However, the prevalence can vary. Western countries tend to report higher rates, possibly due to lifestyle factors and better access to health care, which leads to more diagnoses. But it's not just a Western issue. In Asia, Africa, and South America, many men suffer silently due to societal stigma and lack of awareness. The actual numbers could be much higher than what's officially reported. The point here is, ED is widespread, and it's a problem that affects men of all ages from all walks of life. It's not just a senior issue or a Western issue, it's a global health concern that needs more attention and understanding. As you can see, the number of men struggling with ED is not insignificant. So, what exactly leads to erectile dysfunction? Well, let's dive into that. There are a multitude of factors that can lead to erectile dysfunction, and these can be broadly categorized into two types: physiological and psychological. Physiological causes are often related to the physical condition of the body. These can include heart disease, high cholesterol, high blood pressure, diabetes, obesity, and even certain types of medication. For instance, heart disease can affect blood flow, which is integral to achieving an erection. Diabetes, on the other hand, can cause nerve damage which may impair the signaling process that leads to an erection. Let's not forget about obesity. Excess weight can lead to various health issues like high blood pressure and cholesterol levels, both of which can cause erectile dysfunction. Some medications can also interfere with the body's natural ability to sustain an erection. Switching gears, we have psychological causes. These are issues related to mental health and emotional well-being. Stress is a common culprit, as it can interfere with the brain's ability to send the necessary signals to trigger an erection. Anxiety and depression can also lead to erectile dysfunction, as they can disrupt the balance of chemicals in the brain that regulate sexual desire and performance. In summary, erectile dysfunction can be caused by a myriad of factors, both physical and mental. Understanding these causes is the first step towards finding a permanent solution. The question on everyone's mind now is, can erectile dysfunction be cured permanently? Well, let's explore that. Our world is filled with a myriad of treatment options designed to tackle erectile dysfunction, each with its unique approach and potential outcomes. Firstly, we have lifestyle changes. Things like regular exercise, a healthy diet, and plenty of sleep can do wonders for your overall health, including your sexual health. These changes, coupled with quitting habits such as smoking and alcohol consumption, can significantly improve erectile function over time. Then there's medication. Drugs like sildenafil, tadalafil, and vardenafil have been proven to enhance blood flow to the penis, helping to maintain an erection. Let's not forget therapy. Psychological factors can play a significant role in erectile dysfunction. Cognitive behavioral therapy or sex therapy can help address these issues, providing a more holistic approach to treatment. And finally, there's surgery. Penile implants or vascular surgery are options for men who haven't had success with other treatments. These procedures, although more invasive, could potentially offer a more permanent solution to erectile dysfunction. It's important to remember that what works for one person might not work for another. Each man's journey with erectile dysfunction is unique, and so too should be his treatment plan. In the end, a permanent cure for erectile dysfunction is possible, but it's not a one-size-fits-all solution. It requires a tailored approach, a dedicated mindset, and sometimes a little bit of trial and error. So, what have we learned today about erectile dysfunction? Well, we've established that this condition is far more common than you might think. It's not some rare, isolated issue, but something that affects many men across the globe. We've delved into the causes of erectile dysfunction, highlighting that it's often a symptom of underlying physical or psychological conditions. These can range from heart disease and diabetes to stress and mental health disorders. We've also explored the various treatment options available, from lifestyle changes like regular exercise and a balanced diet, to medical interventions such as medication, therapy, and surgical procedures. Most importantly, we've underscored the potential for a permanent cure. With the right treatment plan, tailored to an individual's specific needs and circumstances, it's entirely possible to overcome erectile dysfunction for good. Remember, it's crucial to open up about issues like ED and seek help. You're not alone, and a permanent solution is possible.